Welcome to Coffee with Dr. Stewart. This show will provide our listeners up-to-date medical information from a leading neurologist and neuroimmune specialist. Your host is Courtney Stewart, and your medical expert is Dr. Kendall Stewart. So grab your favorite beverage or cup of coffee, and let's have Coffee with Dr. Stewart.
Hello, everybody, and welcome back to another episode of Coffee with Dr. Stewart. I'm your host, Courtney Stewart, and today we're going to be bringing you part 2 of tummy trouble. So in our last discussion, we had talked about the gut microbiome and all the different factors within that. We talked about laxatives. We talked about processed foods. We talked about eating dirt.
Yep.
And so now we want to dive into some of the symptoms.
Well, let's back up just one, if you can, okay? I think there's also a mistake being made by a lot of doctors and people.
Okay.
That because of this whole gut issue, the mistake I think is being made is the problem is you don't necessarily know if the microbiome's the problem or if the immune system of the body's the problem.
Okay.
Okay? And so because they're synergistically bonded, the problem is it can go both ways.
Okay.
Meaning if the immune system is fired up or genetically abnormal or you have a chronic disease state, everybody thinks, oh, we got to go fix the gut. But the problem is you take somebody who's got massive inflammation in their immune system from some other source, good luck trying to fix the gut.
Yeah.
Because that inflammation has to be twofold. So I believe if there's anything I could tell a young doctor out there about taking care of these types of patients, I would tell him that we really have to focus on, yes, the gut issues themselves, looking at the microbiome, doing things to help it, but we then also got to pay attention to the immune system and make sure we do something to rebalance or calm the immune inflammatory tendencies.
Okay.
Because it goes both ways.
Yeah.
And I think a lot of people forget about that.
Yeah.
Okay.
Yeah, no two organ systems work individually. They all
That's
they
exactly
all work
right.
together.
That's a great statement. So everybody knows that histamines are used by the immune system for allergic responses.
Yes.
Okay. The problem is a lot of foods actually make histamines, and God knew that. So what happens is God has actually put 2 enzymes that basically break down histamines. One's labeled AOC1 on the genetic report, another was HNMT. And anytime there's something that's a backup system's provided, that means that is a very important process. So it would be a disaster for our immune system to eat a food containing histamines and all of a sudden your immune system goes off. Yeah. Now, unfortunately, those can be mutated in some people, which means they don't have those enzymes' ability to break it down. And if we're not careful and those people consume a lot of histamine-containing foods, then they tend to get into mast cell degranulation syndrome. Okay. And mast cell syndrome is a well-known inflammatory syndrome of the bowel, but it comes from histamines of external source. Oh. Okay.
Interesting.
And those people are chronically food reactive. They have to watch everything they eat. Those are the people that are really just they're crazy about how detailed and how many things they need to know about every food. Okay, you've probably seen those types of people, but you got to realize how bad that reaction can be for these people.
So it's not necessarily, was it considered an allergy then? Or
it is. It's an allergy type of thing, but it's actually an allergy based on the chemical itself, not the allergy coming from the immune system. Oh. It doesn't matter if the histamine comes from the food or the histamine comes from the immune system. You're still going to have a histamine reaction in the body. And that typically is hives, swelling, itching, irritation, and that is the last thing you want. Imagine blebs on your bowel inside your body, how you would feel with that.
Wow.
Yeah. And then what happens is if you keep eating the histamines, you not only have those types of reactions and you feel terrible, what happens because the gut then becomes leaky, all of a sudden you tend to then get into major food sensitivities and off we go into a chronically ill person.
Wow.
Yeah.
Yeah. Another part of it would be, or another symptom would be like infections.
Yep.
As that being the source. Can you expand on that?
Sure. So that's another complicated issue. And the biggest problem is when you're dealing with bowel issues, it's hard to know whether it's SIBO.
Okay.
It's hard to know whether it's SIBO with biofilms. It's hard to know, is it just a food sensitivity or allergic reaction? So going through the process of trying to understand by listening to the patient can be very, very complicated in understanding. Now, there are some fairly sophisticated tests for SIBO where we measure gases that you're breathing, because you remember all bad bacteria create certain gases, and we can actually measure those to see if you have SIBO. Okay. I can tell you microbiome testing can help you, but it seems to be a little expensive way to go about it, you know, and, you know, this economy these days, people don't love to spend tons of money trying to find out what it is. So a lot of people, if you give them the option, will choose to just go for the treatment instead of that. We also got to understand that it's hard to tell when biofilms are involved or not. The way I typically look at it, though, is if you are having diarrhea or you're having things like that, or you see food that's not digested, usually we're probably dealing with a biofilm. Or if you see certain lab work where a lot of vitamins are missing, or somebody is really just massively fatigued and you see signs of poor nutrition, okay? And the easiest way to tell about nutrition is to actually look at some of the globulins in the body, the proteins, to see if they're actually being made, because people who are have malnutrition are not able to make those proteins as effectively, and you can get an idea whether you need to go about it. Okay. Now, when you're dealing with infections, I like to consider that there's biofilms probably always there these days. And, you know, and biofilms have been linked to dental disease. They've been linked all the way from one end of the gut to the other. Yeah,
we talked a little bit about
Right. And so there are many ways to go after biofilms. There's natural ways to do it. Peppermint oil is another one that's really good. Peppermint oil seems to be ridiculously effective in the bowel.
Why is that?
Well, it's just got so many chemical properties to it. It tends to also stimulate the gut to move. And that may be why we kind of got in the habit, a lot of us, of eating peppermints after
chewing
meals.
All the things.
Peppermint oil can break down biofilms if it's at high enough concentrations. We have other foods that can do it. We have enzymes that can do it. A fairly well-known one is called the serrapeptidases, and they tend to break down biofilms. We also know that other enzymes can have an effect on these biofilms, and then we also know that certain chelating agents, in particular EDTA, which grabs calcium, can actually grab the calcium out of the biofilm, and it'll start to fall apart because it's held together with calcium bonds. The problem with dealing with chelating agents, though, is you got to be a little careful, because anytime you pull out something bad or something that's needed, you're pulling out good stuff too. Yeah. So when I use those types of things, I like to actually use something that pulls minerals one day, and then I like to replace minerals the next day. So I like to alternate days. And then there's some combination agents that are out there where you kind of put everything together. But biofilms, I think, are going to be present a lot more than we think. Okay. So you can't just take an antibiotic, think you're going to get rid of SIBO, because if that antibiotic doesn't get where it's supposed to go, then you're really in trouble. Yeah. And we also know that bacteria in the gut have developed all kinds of ways to, I won't say not respond to antibiotics, but resist antibiotics. And which means that maybe not all of them are killed and they're ready to come back. And so, you know, the whole philosophy in my mind for so many years was, let's just wipe the gut clean with an antibiotic, antifungal, and then let's put the good stuff in. It'll be replaced, and it's really easy. It ain't easy.
It doesn't work that way.
And it's actually way more complex than we ever thought.
Yeah.
And I think we're just finally getting our hands around it, but there's still so much research to be done on that. But, you know, if you're having chronic gut issues, there's a very good chance that you have bacterial overgrowth, you have abnormal yeast colonies, parasites is a big discussion, not so much in the United States, but certainly in other countries. Surprisingly, I have had a lot of benefit, pretty much accidentally, using ivermectin.
Yeah.
It turns out when I was using ivermectin for things like COVID or other things like that in short courses, we kind of noticed that the bowel in people who had IBS and other things actually got better. Now, we only dose it a couple of times a week. We're not using very concentrated doses of it. But I've really noticed that getting on ivermectin tends to cause the bowel to actually calm down.
Really?
Now, so my philosophy on that is when we check for parasites in the stool, we don't find them a lot.
Yeah.
Okay? Now, a lot of people have a big discussion about that. And because most people think ivermectin is only an antiparasitic, I think that when they used these antiparasitics and saw bowel improvement, I think they thought, oh, it must be parasites, right? Well, it turns out we found out that ivermectin is an antibacterial, it's an anti-inflammatory, it can even be kind of a cancer down regulator. I won't say cure, but a cancer down regulator, and it has all kinds of effects. So we're learning about old medicines a lot lately and new uses for them, but that's one that I tend to use in combination with other things to see if I can't get the bowel to calm down.
Yeah. This is random, but there was one TikTok or Instagram story that I've seen where women were talking about their toddlers who were like nonverbal, and they said they then did like a heavy metal cleanse, and then like there was parasites or something that came out of them, and then they next few weeks they were talking and they were more interactive.
Yeah,
Do you have any idea?
That's a huge topic too.
You have an idea like
So,
how that works?
You know how we talked about the symbiosis of certain organisms in the bowel? Well, there are a lot of people. In fact, there's some autism researchers that actually introduce parasites into the bowel to essentially stop a lot of the resistant, in particular roundworms. They tended to use those. And so there seems to be that we did have some type of relationship with parasites before we had all these agents that kill things. And so it's a very complicated course of understanding whether we have a symbiotic relationship or whether obviously certain parasites are not symbiotic. They don't belong there. I can tell you it's not something that has been worked out very well.
Okay.
I can tell you also that you've got to understand that a lot of those cleanses, heavy metal cleanse, almost all chemicals that are in the environment, we have found multiple uses for them. So whatever somebody touts as one use, you've also got to step back, especially as a biochemist, cell biologist, and say, okay, is that really the effect that it was having, or did it do it some other way?
Yeah.
Because heavy metals and autism have been a topic for a very long time. And we do know that the metallothioneins, the heavy metal clearance agents that we produce in the body to clear heavy metals, can be compromised in kids with autism. What's not so clear is that a cleanse of the heavy metals being not just a symptom, but the primary cause is typically not my experience.
Yeah.
Okay. But I will tell you that we certainly can see that.
That's interesting.
And I think you also have to be careful when you're doing these natural cleanses, because a lot of the effects you're using is not the cleanse itself, even though we label it as a cleanse.
Okay.
It's not really a cleanse. It's a true biochemical reaction and support reaction that we're giving to the liver, we're giving to the bowel, and we're giving to the immune system that can have all kinds of effects.
Okay.
In fact, I mean, a great example would be like curcumin. Okay. Curry.
Yeah.
Okay. Curcumin, I mean, I can think of 20 effects that it has in the body. Antioxidant effects on the mitochondria, NRF2 effects on the nucleus, where it helps make glutathione and it helps turn on genes and turn off genes. I can think of effects where it actually has a toxic effect on certain bacteria. I mean, it can also break down biofilms. I mean, you got to understand that these chemicals that are created have all kinds of beautiful effects on the body.
Yeah.
And I like to say that God never uses one thing for one thing.
Yeah.
He uses it for lots of things. Okay. And the more chemistry and cell biology you learn, the more you really realize that, it's multifactorial.
Yeah.
Yeah.
Yeah. I know you say that like treating the digestive system is one of the hardest things to treat.
Yeah.
And would you say that has to do with people's lifestyles and that you can't control what they're eating or what they're intaking. Could you expand on that?
Well, as a physician, I can tell you that if we can't fix the bowel, we blame the patient.
Yeah.
Okay? Now, I don't like that. I can tell you it happens all the time, and especially if they're teenagers. And, or we'll say, oh, they got secondary gain. That teenager just doesn't want to go to school. Do you understand?
Yeah.
So the problem we really have is not only the bowel's complexity with understanding the relationship with all these probiotics and the environment of the bowel, but we also just don't have outstanding testing that is understood very well. We have outstanding testing. It's just not known very well.
Yeah.
And trying to get a handle on the immune response to that is just adds another layer of complexity. And really, there's no great test for biofilms. For SIBO, we also have organic acid tests. A lot of doctors aren't versed in that. So what they're doing is they're measuring a metabolite of something that's abnormal in the bowel and measuring in the blood to see if it's present and saying, oh, if this is present, then this bacteria that's bad must be in the bowel.
Okay.
So organic acids are about that type of thing. There's just not a widely accepted method for getting our hands around the complications of the bowel. Although I don't think there's too many professionals out there today that now don't recognize the importance of the bowel. But I like to also say that when you stretch the bowel out, you're covering the size of a tennis court.
Yeah.
So if you've got some irritation, I like to say if you got inflammation in your bowel, the size of a tennis court rolled up and put in your tummy, you are not a happy camper.
Yep. And I know we had talked about that in our inflammation podcast.
Absolutely. So in general, I can tell you, I think it really lacks the objectivity that it needs to have.
Okay.
And the problem with that also is the diet.
Yeah.
So a lot of the diets that really can help the intestinal tract are boring. Really boring by Western standards.
Yeah.
Okay. You know, I see this all the time because in epilepsy, for instance, we know that a diet that doesn't stimulate insulin tends to be very successful, a ketogenic diet.
Yeah.
We also know that in lots of gas and lots of irritable bowel, there's a FODMAP diet where we actually avoid certain types of sugars. It actually stands for 3 different types of sugars and a sugar alcohol that are very simple sugars that the bacteria break down very easily and produce lots of gas.
Yeah.
And so that's called the FODMAP. You can read about it. But the FODMAP is something that will cut down on the gas in your bowel. But it has very specific foods that you eat that have fibers that are typically non-digestible versus some foods that have fibers that are soluble and insoluble and high levels of sugars with them.
Okay. And do you think diets like that, could they just be short term, or do you think a lot of these people have to go longer than they actually think? Like it couldn't just be a 3
I think it's always longer than you think. The problem is how long can you stand it?
Yeah.
And what's the big problem with me is traveling.
Yeah.
Try to travel and stay on a diet.
Doesn't work.
I mean, you literally got to pack your food. So I feel sorry for these moms who have kids that are dietary sensitivities of some sort. They literally pack, I mean, ridiculous amounts. And you know how kids are. You're in the car, I want a snack. And you know what I mean? And so, I mean, God bless those moms that do all that. But it's hard enough being a mom, much less having to carry all the food that your family's going to eat when you go. And frankly, it really distracts from the ability of you to take a vacation.
Yeah.
You know? But you certainly can't go to Burger King or Wendy's or the Sub Shop or wherever you want to go.
No.
On a vacation.
Restaurant, no.
Pizza, you ain't going to do it.
No, you can't.
And then where you can go, you can't afford.
Yeah.
So, I don't know. So I just think diet's a great way. So the way I approach it, we used to be taught that if you had a dietary issue or an immune cell that was overreactive, okay, let's say that once I stimulate this immune cell, some of them are genetic. Some people have genetics where will just explode. So the idea was diet plays a big role in that. So we'd send them over here, and I basically like to say they were told to eat water and cardboard. Because that seems like when you get the limitations that's all you're
that's
eat.
what it feels like.
But the whole idea is that, diet can help, but those diets are so restrictive that if you even cheat a little bit, this cell will go off. Mm-hmm. So basically about 10 to 15 years ago, I started thinking, well, why didn't we just modify this cell?
Yeah, retraining your cell.
Well, or treating it where it wasn't as reactive. Do you understand? So when you get genetic testing and you find out where your problem really is, and we can use some things, whether they're natural or whether they're prescriptive or whatever, to control the cell, then we can be a little bit more liberal over here without worrying about my kid accidentally eating something they weren't supposed to, or me eating something I wasn't supposed to, and I'm going to a meeting and now my stomach's killing me and I'm trying to find a bathroom.
Yeah.
You understand? I saw a commercial the other day for somebody with IBS, and it was like, this will help you not have to be within 5 minutes of a bathroom at all times, and that's pretty much the way it feels, I think, for those people. So if I can just push anything through, being more of an immune guy, I mean, we have to talk about diet. You have to know about diet when it comes to immune system.
Yeah.
But being able to say, okay, this is not the whole picture.
Yeah.
We've got to then take this and calm it down so it's not as reactive.
Okay.
And we can live a little bit more freely. Now, there's a lot of people that if you really have true gluten sensitivity, you're probably not going to be able to eat gluten.
Yeah.
But we can make it where if something accidentally slips in, maybe you don't have a child that explodes into rage or histamine reaction or a massive inflammatory reaction by accident.
Yeah. And how can you make the cell less reactive?
So those are the things that we use that are immune modulators.
Okay.
So I tend to use low-dose naltrexone. I tend to use PEA. You can use CBD oil. The problem with CBD oil is you have to use a purified form because CBD oil has so many different chemicals within it. I mean, when you first press the cannabis plant, there's about 20 to 25 chemicals in that combination. And so if you eat it or swallow it when you're trying to treat something and your bowel is reactive, you'll react to something in it, and all of a sudden you can't take CBD anymore. And it doesn't mean it was the things that would really help you, like cannabidiol, but it just means that you were exposed to something. So I like more of the purified forms if you're going to use that. Occasionally we use hydroxychloroquine over here. We can use steroids of certain types. Vitamin D is an excellent steroid. And so all of those concepts of immune stability, the microbiome is part of that. Don't get me wrong. If we get this more stable, the immune system is much happier. But you've got to address both, and that's the hard part, because when the patient comes in, you want to help them. You want an easy fix. You want them to go out and say, Dr. Stewart is the smartest doctor, and he's wonderful. But that's not this type of stuff. It tends to be 4, 5, 6 visits sometime before you get it right.
Yeah.
And you just say, I'm sorry, but sometimes we have to look deeper.
So what effect could convenience culture have on the gut microbiome?
Oh, my goodness. Okay. So when you get snacky and run into the 7-Eleven, what are you going to get?
What I want would be
There's
chips.
fresh fruit there, but what do you typically get? Chips, cookies, candy, okay?
Road trip snacks.
Right? Bread, maybe a little sandwich. You might feel good that you got some protein in that, but you're really after the carbohydrate.
Yeah.
So that's the problem with convenience culture, and most fast food is like that too. And I'm really shocked at really understanding, especially in the younger people, how much they eat out.
Yeah.
Okay. And so
problem.
It's really, really interesting. I'm really kind of impressed with these new companies that basically ship you fresh food and show you how to cook it. So they include it for the meal. Okay. I don't know what they're called, HelloFresh, things like that. That really makes a lot more sense to me from a perspective of health than going out to a restaurant, because restaurants are all about flavor. They're all about getting you to be a return customer. So the salt content, The quality of the food can be compromised. So when you're cutting it up yourself and you're preparing yourself and you're cooking it yourself, you're going to be much better off because you're going to eat a much bigger variety of foods. So if I can say anything to young people who don't have enough time, or even professionals who don't have enough time, utilizing maybe a service like that would be far, far better.
Yeah. Well, I think this has been a wonderful episode on tummy trouble and all of the different ways that you can treat it, educating on a lot of different things that I think people, we don't think
wish
about
I could
it.
Spend more time.
We think of it as just our stomach when it's has a very important factor into our everyday lives. Yes, so this has been a good conversation. Thank you all for joining us for another episode of Coffee with Dr. Stewart. Make sure you follow us on all of our social medias and tune in for the next episode. Thank you and be blessed.
This show is for entertainment purposes only. Please do not use anything mentioned in this show as your own medical advice. Please discuss all medical issues with your own provider.